Hey, everybody. Thank you all for coming. I'm going to wait one more minute and then we will start. I'm glad this is on Zoom because it's such a lovely night out.
Great.
Not so pretty where I'm sitting either.
Yeah, gray skies.
A very close friend of mine did marketing for an organization founded out of Concord called 1 in 40. And I cannot remember the name of the founder who has since passed away.
Lauren Kordak.
Thank you. From ovarian cancer at a very young age with two very young children. My friend Helen asked me last fall, she introduced me to Sarah Eagle, who works for Sharsheret, and asked me to do a program. And between Shauna and some very young temple members that have been going through breast cancer and colorectal cancer, where there is now an uptick in people in their 30s, 20s, 30s, and 40s with colorectal cancer, I thought that the timing was perfect. So thank you for joining. I'd like to introduce you all to Melissa Rosen. She is Sharsheret's Director of Training and Education. She holds a master's degree in Jewish Communal Service from Brandeis. I'm sorry, I need to admit people. And did you do that for me,
I
Melissa?
let her in while you were
Okay,
talking.
I'll keep going. You can do that. Thank you. She's been working in the nonprofit sector for over 30 years. Her professional experience includes informal education and programming, advocacy, and community outreach. Melissa's work has allowed her to facilitate unique and lasting connections among organizations in the diverse American Jewish community. Melissa oversees community education throughout the country, training healthcare professionals, Jewish professionals, and Sharsheret volunteers. She also manages the Sharsheret Supports Partnership program. Herself a two-time cancer survivor, she is passionate about the Jewish community and cancer support and advocacy. She has asked that if you have questions, immediately put them into the chat. And as timing, we'll see if maybe at the end we'll unmute everybody and have a conversation. Thank you, Melissa.
Thank you so much, Susan, and thank you all for coming this evening. It's a pleasure to be here. While I got on early and Susan and I were talking, we realized that many years ago, before COVID, I actually spoke at a 1 in 40 event at your temple. So I feel honored to be back. Thank you. I want to start off by telling you what we're going to do today. So I'm going to introduce you to Sharsheret, and for those of you who are familiar with us, I promise you there are new things that we are providing that you may not be aware of. We're mostly going to talk about how to determine personal risk and how to learn how to manage that risk and mitigate it. Talk a little bit about signs and symptoms, talk a little bit, especially because Susan noted there are members of your community facing cancer at the moment, some of the best ways to support those people and their families, and also how you can raise awareness, because we know that raising awareness saves lives. Just a little bit about Sharsheret to start with. We are the only organization in North America that provides culturally meaningful support for Jewish women and families facing breast cancer or ovarian cancer, or men and women who are living with a higher diagnostic risk of some of these hereditary cancers we'll talk a little bit more about. You know, other than how do you pronounce Sharsheret, one of the most common questions we get is why a Jewish organization? There are so many great cancer organizations out there, and thank goodness there are, and thank goodness we actually work with a great number of them. We're a very collaborative community. But the same reasons exist today as they did 22 years ago when we were founded. First is Jews of Ashkenazi or Eastern European descent have 10 times the risk of carrying a BRCA mutation than the general population. We can get into that a little bit more in a bit, but that means we need to be aware differently. We need to be proactive differently. And then listen, you know, everybody facing cancer deserves culturally meaningful care because we know that patients whose non-medical needs are met, any patient, any non-medical needs, from financial to childcare to faith and culture, those patients actually do better medically, right? It doesn't make sense to say, if you meet a patient's non-medical needs, they'll do better medically. But test after or study after study has proven that. So let me give you a couple of examples of what a non-medical, culturally relevant to the Jewish community need might be. Let's start with tattooing. Listen, there is a huge taboo against tattooing within the Jewish community. That isn't to say that there aren't Jews with awesome tattoos. Of course there are, but there is a taboo, and there are 2 times within a breast cancer specifically experience that one might need to get tattoos. The first is if they need radiation therapy. They use pinpoint tattoos on the torso to ensure that the radiation is going exactly where it needs to go and that healthy tissue is not damaged. The second time is if somebody wants a breast reconstruction. One of the ways to recreate nipples and areolas is through tattooing. 3-dimensional tattoos that look so real that unless you touch it, you have no idea it's not real. So whether a person decides they don't want to get a tattoo because by Jewish law you're not supposed to change your body, or because someone has a grandparent that was tattooed against their will in Nazi concentration camps, and so it feels almost like a betrayal to get a tattoo. Or this Bubba mindset, right? This Bubba mindset that you can't be buried in a Jewish cemetery. I'm here to tell you that is wrong. You can be buried in a Jewish cemetery if you have tattoos. But there are a lot of reasons that people don't. So sometimes people will call us and say, you know, radiation is coming up and I'm terrified because I don't want to get a tattoo. And so we'll talk to them about that. You know, what about the high holidays? High holidays where you go to temple and you say the Unatana Tokef, who shall live and who shall die, right? You've said it every year of your life since you've been able to read, and you've never given it a second thought. But someone has been diagnosed with cancer and they think to themselves, how can I go say that this year? And then they think to themselves, wait, this is the year I'm really asking for my life. How can I not go say it? So those are just 2 of many examples of this culturally nuanced support that those facing breast or ovarian cancer can't get anywhere else. I do want to say, though, we help everyone. So we are a Jewish organization and a proud Jewish organization, and we offer something to the Jewish community that they can't find anywhere else. But our programs are open to all and without any religious agenda. So we help people who have no connection to Judaism. We help secular Jews, liberal Jews, ultra-Orthodox Jews, everybody. We help everybody, and that's very important to us. And because we work with people who are at higher diagnostic risk, that means we're working with families at all stages, including before a diagnosis even happens. As well as during the diagnostic process, treatment, if the disease becomes metastatic or spreads, and then of course short and long-term survivorship. I'm gonna table the rest of what I'm gonna tell you about Sharsheret. We'll do that at the end. But I want to get into the important stuff that can be life-saving. So Sharsheret, we really believe in stories. In fact, when we hire a new staff person at their first staff meeting, they need to tell their Sharsheret story. And by the way, you don't need to have had cancer to have a Sharsheret story. Sharsheret might have helped your, a neighbor, or you might have run in a marathon in support of Sharsheret, or maybe years ago you were a member of AE5, which were their national philanthropy. I mean, there are a lot of ways or you may be a healthcare provider who has referred people. A lot of ways to have a Sharsheret story. I actually want to start by telling you my Sharsheret story. Maybe, like I said, maybe you know someone who has been helped by us. Maybe even you, or maybe you've never heard of Sharsheret before tonight. But I'm hoping that tonight will be the start of your Sharsheret story, and you can work to raise awareness and support those around you who need it. My Sharsheret story is this. When I was 29, I was diagnosed with Hodgkin's lymphoma. I had a tumor in my chest, so I needed chest radiation. Because of that chest radiation, my doctor knew that I was at higher risk for breast cancer. And I started mammograms by my mid-30s, much earlier than most women. And I was doing it annually. And at a certain point, my doctor said to me, you know what, time to get a baseline MRI, because starting this year, we're going to alternate. You're going to get a mammogram, then 6 months later, you're going to get an MRI, then 6 months later, you're going to get a mammogram. So of course I went for my baseline MRI, and you can guess what happened next. My baseline MRI diagnosed me with early stage breast cancer. So it turned out that I relied on Sharsheret during that time. I was not working there. And in fact, I was someone who actually stepped down from my job. I was running a rather large Jewish summer camp, and if you can't work in the winter, there will be no summer, and I felt it wasn't fair to the camp. So, I was volunteering or whatever I could do. And when I was ready to get back, and I relied on Sharsheret, and when I was ready to get back to work, they announced a new position, and it was b'sheret, it was meant to be. And I've been with them for 10 years now. I just want to say that it's important to know that I'm telling you my story, not because my story is so unique or particularly special. The moral of my story is I was aware of my risks and worked with my healthcare team to ensure I was doing all I can to reduce my risk of a secondary cancer and failing to catch it very early, which in fact is what happened. So what I want to say is I'm not going to tell you these are the things you must do, because each one of us has a different story to start with, and everybody needs to come up with their own plan. But I'm going to talk to you a little bit about how you can do that. So, I will also say, interestingly, although this presentation clearly is not about COVID, and thank goodness we appear to be through the worst of COVID, in some ways, because of what happened, we're all a little bit more aware of our health and the importance of being proactive. And so that kind of primes us so that we can do what we need to do here. Again, I'm not going to offer you medical advice because we're all different. I'm going to ask you to know yourself, to know your family history. And let's start there. Family history. Do you know, as I mentioned earlier, Jews of Ashkenazi descent, Eastern European descent, have a higher risk of hereditary cancer mutations. And so if we took all of Massachusetts and we did genetic testing on men and women, and people of all different faiths and people from all over the world and all different ethnicities, about 1 in 400 of those people would test positive for a mutation on one of their BRCA. You may have heard it called BRCA genes. If you did that same test only for people who had any Ashkenazi Jewish ancestry, that number isn't 1 in 400, it's 1 in 40. It's 10 times the risk. So it's so important to know where your family is from, but also to know your family's cancer history, right? It's time to talk to them. Whether you're asking or you are the keeper of the history and you're sharing with others, I encourage you to do it now. Do it while people still remember. Do it at a convenient time. Passover's coming up, right? If we're lucky, we're getting together with family. I used to say this about Thanksgiving, but it's clear that the election cycle has already begun. Nobody wants to talk about politics these days. Instead, talk about something that could save lives, right? So when you get together with your family, maybe that's the time to talk about it. I want to remind you, you don't want just your maternal side of the family, right? You want to talk about cancers on your maternal side and your paternal side, because BRCA impacts both men and women in equal numbers, right? And men and women pass those mutations down to their children, male and female, in equal numbers. So it's important to get both sides. And by the way, don't just focus on breast or ovarian. Ask about all cancers. The field of genetics is constantly growing. So yes, of course, ask about breast and ovarian cancer, but also ask about others: prostate, pancreatic, male breast cancer, melanoma. Those are all BRCA related cancers, right? And a few years back, we didn't even realize it, just a few years ago. And now it's very clear. We used to talk about breast, ovarian, and related cancers, but now it's so clear that we're not allowed to say related cancers. We really have to be clear about which ones they are. And by the way, there are other cancers that we have no idea that they're connected to BRCA or another hereditary cancer mutation, but 5 years down the road, we might know that. So it's important to keep it all in one place. By the way, you can go onto the Sharsheret website, and if you Google within the Sharsheret website, if you search family tree, there'll be a family tree specifically designed to mark these cancers. Who was diagnosed, what type of cancer was diagnosed, the age of diagnosis are all important things. So gather as much of that information as possible. I want to say that that one should never turn away knowledge, right? I'm not going to sit here and tell you that everybody should be genetic tested. It's actually a very controversial issue, and I could argue it pro and I could argue it con. It's a decision you're going to need to make. But one thing I will say is you should never turn away knowledge, especially knowledge that might turn out to be life-saving. Sometimes we'll get calls from people who say, there's cancer in my family, but I'm always getting my mammograms on time, and I would never remove a healthy body part anyway. So why do I need to know if I have BRCA, a BRCA mutation? And I just want to let you know that if someone chooses to test and tests positive for a mutation, nobody's going to dictate to them what they have to do. Nobody's going to say, okay, you learn you've carried a mutation, now you have to have prophylactic surgery and remove your breasts and remove your ovaries. There's no mandate for anything. But what there are lots of things one can do to reduce that risk. Including upping your surveillance, like I did, like I was referring to, with switching off with MRIs and mammograms and starting mammograms early. But I'll tell you what, your insurance companies aren't going to pay for those additional screenings unless there's a medically warranted reason to do that. And a known mutation is a medically warranted reason. So that's something to keep in mind. So, okay, so we need to know our family history. 2, we need to know our own body. Even without a BRCA or other hereditary cancer mutation, it's important to know what's normal for your own individual bodies. You know, it's interesting. We know that those who carry mutations have very high rates of a lifetime risk of cancer. For breast cancer, it's, depending on the exact mutation, as high as over 85% over the course of the lifetime versus 12% for the general population. And for ovarian, it could be as high as 50% versus less than 2% for the general population. So those figures seem pretty overwhelming, but I also want to remind you that hereditary cancer diagnoses are only about 5 to 10% of all cancer diagnoses. So of course, it's wonderful to learn that someone does not have a mutation, but that doesn't mean that they can stop caring and being proactive about their health, because 90 to 95% of all cancer diagnoses are not related to a hereditary cancer mutation, which is why I'm saying also, whatever the results of genetic testing, if you get that risk implicated, no. Yes, it is. So Gloria just asked a question. BRCA mutations we now know are breast cancer, ovarian cancer, male breast cancer, pancreatic, prostate, and melanoma. Although they may be pushing back a little on melanoma, it was for sure, and now there's some question. We still recommend that someone who has a known mutation make sure they go for a body scan at a dermatologist, you know, a visual scan once a year. So again, you need to know your family history and possibly your mutation status, but you also need, all of us need to be familiar with our own bodies. So I just want to remind you what that looks like. So we know what the obvious signs of breast cancer are, right? They're lumps. That's what's the first thing everybody thinks of. So yes, be on the lookout for obvious changes, but also subtle concerns. In addition to a lump, it might be a change of color. Your breast gets very red, or there's a scaly rash, or there's a subtle dimple in the breast. Nipple discharge, thickening of the skin, and a rash that almost looks like an enlargement of the pores, like an orange peel, or even an unexplained change on one side, one breast or the other. And, you know, we think about the breast, but I want to be clear, if you notice something that might be a lump or might be a rash or might be a dimple, any of those things, it's not just in the breast mound, so to speak, right? It could be underneath. It could be right here. That's also part of that. And, you know, I don't know if I believe in women's intuition or not, but I have met enough women who said, no, there wasn't a specific symptom, just I knew something wasn't right and I went in. So honor that, right? Honor that feeling if that comes. So, okay, so we know we're looking for our family's history, our own body. Number 3, healthy living. Be proactive about your health in general, not just breast health. All the things that our doctors tell us to do that sometimes we don't want to do actually do mitigate risk, whether one carries a mutation or not. I don't have the figures off the top of my head, but I remember being very shocked at the significant percentage of risk and how it was lowered when people engaged in healthy living behaviors. So first of all, eat well. right? I'm not saying, listen, Passover's coming up. We all have these delicacies we have once a year, whether it's sponge cake or Passover granola or matzah crack or whatever it is that you look forward to every year. I'm not saying don't have them. I'm saying when you sit down for a meal, most of the time, make sure your plate has a whole grain on it, a lean protein, has colorful vegetables on it, so that when you want to have the matzah crack or the lolly cone, you can go ahead and do that. Second thing to keep in mind is, again, something be active. And again, I'm not telling you you need to run a marathon, unless of course you'd like to. And we just announced today that we have spots open in the New York City Marathon for anybody who's interested. But I'm not telling you you need to run a marathon to make an impact. I'm telling you to park a little farther away at the supermarket. Try and walk with your friend or your partner a few days a week. What is take a Zumba class, play soccer with your child or grandchild. All of those things count. And by the way, Passover cleaning counts as exercise too, for those of you who are wondering. And then the third major thing I'm going to talk about, I'm going to tell you, is actually probably the most difficult, which is to reduce stress, right? We're in today's world, we're stressed. There's just no reason to even deny it. But we also have more access to stress reducing resources than we ever had before. There are so many apps, Calm and other ones, many other ones. And you can even go online and join a meditation class or a yoga class. Maybe that's not your thing. Maybe reading is a de-stressor for you, or being in nature, whatever is a distressor for you. That's really important to keep in mind. And those are the major things. Now, of course, there are other things, like smaller things. Do your best to maintain a healthy BMI. Keep drinking alcohol consumption to a small amount. Breastfeeding, if you're able or interested, confers a small reduction in risk. I'm hoping nobody here smokes or even vapes, because of course that raises risk too. But those three that I went to are the main ones. Okay, so we have knowing your family history, we have knowing your own body, we have healthy living behaviors, and now the fourth one. I want you all to promise that you're going to commit to the appropriate screenings and not push them off. Listen, I know we're, like I said, coming out of COVID and the worst of it's behind us, but the National Cancer Institute reports that routine cancer screenings were down as much as 90% during COVID in some parts of the country, and they predict that reduction, that significant reduction, is going to negatively impact cancer outcomes for a minimum of a decade, right? Because the later one catches a diagnosis, the more invasive the treatment, things like that. So, there isn't anybody here on the screen who would let a child or a grandchild's lingering cough go without a trip to the pediatrician. But every day, we put off what we would never allow our dear friends and loved ones to put off. So I want to remind you to put yourself on your own list, right? Here we are. It looks like we're all women here, at least the names I can see. And we often, like, everything else takes precedent but us, right? I have work obligations, and I have to prepare for the holiday, and I've made volunteer commitments and family things that need to take. All of those things are real, but you can't do any of those things unless you're healthy. Still, I know that some people have trouble doing it anyway, right? So I want to reframe it for you. I want to reframe it. instead of caring for yourself, think of it as a mentoring behavior. Mentoring behavior, because how will your children, whether they're 3 or 33, know they need to care for themselves unless they see you caring for yourself, right? We all know, if we are parents, do what I say, not what I do, doesn't work, right? So not only go to the routine physicals and the screening tests that are necessary for you, but talk about it too. You could sit down at dinner and say, oh, by the way, I had my mammogram this year. What a pain, but all good. I'm set for another year. Normalize self-care, not just with your family, the women who you sit next to at temple, your friends and your colleagues, right? We have to normalize this kind of thing. So with all of those things that I talked about, know your family history, know your own body, healthy living behaviors, committing to the appropriate screenings, I want to take a step back and how will you know what those screenings are? Each one of you will have a conversation with your doctor, whether that is your primary care physician, your OB/GYN, an oncologist if you already have one, whoever it is, and you're going to bring that family history to them and your own personal health history. And together you'll decide if genetic testing makes sense. And if you still have questions, you can call Sharsheret's genetic counselor who can talk to you. You can get an appointment within a week, and it's free of cost to have that conversation. And then with the results of that test, if you choose to take that, and everything else we know, your family's health history, your own health history, your age, your doctor and you will set a plan of what needs to happen. And your plan's going to look different from your plan, and your plan's going to look different from your plan. But it's important to have a personalized plan. And that plan may include extra screenings or may not. It may include, and by the way, you might not even need extra screenings, because you have a higher risk of cancer, but maybe you have dense breasts. So even though your risk is normal or average, it's harder to find cancer on screenings with dense breasts. So don't assume that if the doctor prescribes different types of testing modalities or frequencies that it means you're at higher risk. Have that conversation. It might just mean you have dense breasts or another factor that means the doctor wants to add something. But in addition to caring for your breast health, your plan might include, colonoscopies every however often your doctor thinks, or PSAs for the men in your life. It may include flu shots. It may include any number, an annual physical. Who in the world decided that at 18, well checks were no longer, after you leave your pediatrician, nobody needs to have well checks? We don't just go to the doctor when we're sick. And that's important to keep in mind. I know plenty of the women who only go to the doctor when they're pregnant or when they're ill. That is not the way to do it, right? So you're going to come up with a plan. It's going to include annual well visits and any of these other things that we've talked about. And then, like I said, commit to those. And all we spoke about will help lower your risk. Of course, we know it can't prevent all diagnoses, but if a diagnosis does occur, it will help you be diagnosed sooner, which increases survival rates and may allow for less invasive treatment. And by the way, being healthy gives you the strength to heal. And that's really important. So I have a little more I want to talk about. I want to talk about Sharsheret a little more. I want to talk about your Sharsheret stories. But what I'd like to do now is take a little break. We're a nice, intimate group. Feel free to unmute if you have any questions or thoughts you want to share or anything like that, and then I'll finish up with what I want to talk about. Gloria, are you raising your hand? Still muted. Should be bottom left of your computer.
Unmute.
There
Can
you
you hear
go.
me?
Yeah.
Oh, thank you. I was my interest was piqued when you were talking about these genetic relations of the cancers. How I had never heard it before, and yet we've had, male cancer. No one has ever had that conversation about testing with the men as opposed to the women.
Yeah, and that is a problem in the healthcare community. And it's something we're working to change, but along with many other organizations, not just us. But the reality is that that in medical school, medical students only get 1 or 2 genetics classes. And if those genetics classes are more than 5 years old, they're basically irrelevant anyway, other than understanding the basics. So we still get calls from women who say, like, I can't believe this is happening. I actually, yes, I can, Stephanie. I actually asked my doctor if I needed genetic testing, and he said no. All the cancer was on my father's side of the family, and so we actually just printed 2 different male health and genetic educational brochures. And we can even send some to the temple so they can go out alongside the ones for women. We have a Know the Facts for women and a Know the Facts for men. And they have similar purposes, but really focus on different disease. But they also include signs and symptoms for each of those relevant diseases. They include questions to ask your doctor, how to advocate for yourself, things like that.
Well, if you're of Jewish Ashkenazic descent and you've had a male has had one of these cancers, would that indicate that they should be tested?
A good bet, but there are a lot of other factors to keep in mind. First of all, any man who has male breast cancer should be tested. But for prostate or pancreatic or maybe even melanoma, it depends on age of onset. It depends on, like, an 80-year-old with prostate cancer is probably just an 80-year-old with prostate cancer, but a 40-year-old with prostate cancer should absolutely be tested. Sometimes it depends on the subtype of the cancer. If it's a particularly aggressive cancer or something like that, yes. But any male with any of those cancers should 100% be having a conversation with their doctor or a genetic counselor about it.
Thank you.
Sure. So somebody asked if I could share the symptoms of ovarian cancer, and I am happy to do so, but with a caveat. The caveat is the symptoms of ovarian cancer, unfortunately, are very vague. They're symptoms that as women we always have, right? Abdominal cramping. I mean, if we're still having our cycle, that happens on a regular basis. Other symptoms include bloating. That doesn't go away, but may get worse after eating. Feeling full very quickly. Constipation, painful intercourse. Those are the main symptoms. And like I said, each one of those has 10 other reasons why they might be occurring, which is why it's particularly challenging with ovarian cancer. And there isn't really even a great screening test for ovarian cancer. There's the CA-125 blood test, but it's still controversial as to how well it works. So what we recommend is, if you have one of those symptoms that persists, that does not go away in a time you would expect it to go away, it's worth a conversation with a doctor. It's probably nothing. It's really probably nothing, but it's worth a conversation. Any other questions, comments, thoughts? Cheryl, she's away. Did you have, I saw you were raising your hand earlier.
Oh, yeah. I have to just plug in my computer.
In there.
Yeah. So I have the BRCA gene mutation. and I had breast cancer when I was 42. And it's now 33 years later, and I'm fine. So I was very lucky.
Congratulations. That is a
Thank you.
great story.
I was very lucky. Every woman in my father's side of the family had breast cancer, with the exception of one cousin. And so it was no surprise, but of course, you know, it's shocking.
Yeah.
And they didn't know about the BRCA gene mutation until 1999 when I was tested and I had it. So my question is, my daughter fortunately is test negative, and I have a son, and my son has my two granddaughters. And when I mentioned it to him and to my daughter-in-law, they just ignored it. So I did speak, I still see an oncologist because of my risk factor, and like you have the mammogram, and
Right.
6 months later, the breast MRI. My oncologist said, wait till the girls are, 20, because
Right.
then they might start some surveillance.
Right.
But it's years away. So I just wonder if you or anyone else has any advice how to talk. And then I have 3 brothers. So they're all at risk for breast cancer. And two of them have adopted children, and one of them has a natural born child. So she's at risk.
Right.
And then I talked to all my fathers, by both sides of the family. Everybody was notified. One actually died right after I notified her. She had died from endometrial cancer. So how do you talk to somebody if they're just not, they bury their head in the sand? And that happens. I have friends who won't get tested, and their mothers have had breast cancer, and
Yeah.
they just are afraid to know. I mean, in my
Yeah.
case, it was not a difficult decision about what to do. I, had a hysterectomy, my ovaries, and that's all I did. And then I watched closely.
Right.
But how do you talk to somebody, your children,
Right.
when they just don't want to know, or your brothers, and they just,
So a couple of thoughts. Listen, there's no magic bullet here. And I can actually get your information. We have a brand new brochure called Talking to Your Adult Children about your cancer mutation that has some really solid information. But there are 2 things I would share. One is that sometimes when we think about genetic mutations, they're terrifying. There are genetic mutations that mean a person will indeed get a disease, and in many of those cases, there is no cure for the disease. So, like an example of that would be Huntington's chorea, right? If you have the mutation, there's nothing you can do. And so the conversation about testing for a Huntington's mutation versus testing for a BRCA mutation should be very different. People who aren't aware might not realize there's a difference, but BRCA mutations, as well as CHEK2 and PALB2 and these other similar mutations, are actionable. Knowing you have a mutation means you can take steps to save your life. And I think that that's a pretty big misunderstanding that the general population has, right? We wouldn't ask you. I can understand why somebody wouldn't want to test for Huntington's. Why would you you can't do anything about it, so why be worrying about it every day? Here, you can absolutely do something about it, whether it's choosing prophylactic surgery or choosing active heightened surveillance. Those are potentially life-saving measures. So that's to explain that, right? And for your son and his 2 daughters, right, you could make an argument that it doesn't make sense to wait till the 2 daughters are in their early 20s, because this could be just as relevant for your son and his health. So that's one thing I will say. The other thing is just a reminder that this isn't just a woman's mutation. I think men are far less likely to take action still, because it's very hard for us to internalize that this is just as much a men's mutation as a woman's mutation. And what I have seen with regard to this would be hilarious if it wasn't so horrifying. Like I once spoke at a congregation, and the person I was working with said, we're intentionally making this a co-ed event, and we want you to focus a lot on how men are impacted by BRCA mutations. And I always talk about it, but I spent a lot of time talking about it during this presentation, which was before COVID and in person. And after the presentation was done, I was milling around talking to the congregants, and a woman came up to me to thank me and said, you know, what you said was so important, but thankfully I only have sons. I'm sorry, did you not listen to what I just said? But it's so hard for us to internalize. It's called the BRCA gene. BR stands for breast, CA stands for cancer. It also impacts ovaries. We hear breasts and ovaries, and our mind automatically goes to women. So a reminder that that actually is just as impactful for men is really important. The third thing, I said I was only going to tell you two things, but I'm going to tell you one more thing. The third thing is that some people, you can't force somebody to do it, right? Some people's medical anxiety is just so high that they're not able to deal with it. And you know, it is what it is. This is not something you can bully somebody into doing. They need to take responsibility for their own health, and as hard as that may be to watch, it might actually have like a very negative outcome if somebody is forced into doing it. Not necessarily medically, but from a psychosocial perspective. Okay, I did that. I'm not going to worry about my health from now on, or whatever it is. But I think the two things are A, actionable, and B, men and women. No easy answers, but I hope that helped a little bit. Yeah, Susan.
Three different people, three different stories. One of Jeff's uncles had breast cancer. A very close friend of ours, under the age of 60, a male, 2 years ago, had breast cancer. And I have a friend from the temple who was tested for the BRCA gene because her father had colon cancer. Turned out she had it and prophylactically had everything removed. My father had colon cancer, but because there was no follow-up or treatment and it was whatever, my GYN and I have decided that I am at very low risk. But it all affects everybody. And so now I worry about Jonah, Cheryl. But as a parent, I think you can only give him the information, and he's a grown man, and let him do what he feels is right. But I think that male breast cancer is probably a taboo subject.
For sure it is.
But
For
it
sure it is. Right? Yeah, it's definitely not easy. By the way, you know, you talk about colon cancer, and we've really focused on BRCA mutations here, but there are other mutations. So BRCA isn't currently associated with colon, but there are mutations that raise risk of both breast and colon cancer. CHEK2 is a good example of that. There's really not, and of the hereditary cancer syndrome, like the primary hereditary cancer syndromes, it's the BRCA mutations and then a few other mutations that raise risk of colon or just gastrointestinal in general, and also uterine. Those are the two other associated with them. Why we talk about BRCA more than we talk about the others is BRCA is so much more prevalent in the Ashkenazi Jewish population, whereas the others, if it's more common, it's negligible from the general population. Also, BRCA mutations are high penetrance. There's a significant jump in risk associated with them, where these others, there are significant jumps, but not nearly at the level of BRCA. Any other questions?
I have another question, Melissa.
Yeah.
So my mother died of breast cancer and her youngest brother died of pancreatic cancer a few years later. So after these two deaths, I went and got a full panel of genetic testing for myself,
Yes.
and it turned up a BRCA gene of unknown significance.
A variant of unknown significance.
Yes. So, and interestingly enough, it also showed that I'm a carrier of BLM.
I don't know what that is.
Bloom helicase syndrome.
Oh.
Again, common among Ashkenazi Jews. And so my daughter and her husband are going through genetic testing now to see if they have it. Like, I never even thought of that. You know, back when my husband and I got married in the 80s, you know, it was Tay-Sachs is what we were tested for, and BLM, you know, nobody knew, thank goodness. We're not both carriers.
Right.
But, so with a BRCA of, you know, undetermined significance, because they just haven't seen it enough to know what it means, are there any precautions that you would advise, or just
no? A little advice. So a BRCA mutation of which is a variant of unknown significance. I'll tell you a couple things about variants of unknown significance. Sometimes they haven't seen it enough to know if it's detrimental or just a random variant that doesn't cause any harm. Sometimes some genetic labs count it as a variant of unknown significance and others count it as a mutation. And so I'll tell you my own personal story. My grandmother had died of pancreatic, my aunt of breast cancer, my cousin had ovarian cancer. So I'm thinking to myself, even though I'm pretty sure my breast cancer was a result of chest radiation for my first cancer, I'm thinking to myself, there's got to be a BRCA mutation in my father's line. Nope, we all tested negative for it. And I tested negative for it and all other mutations. Just a few years ago, my doctor said, you know what, there's been enough change in the panel screening. Let's screen you again. So this time I came up with a CHEK2 variant of unknown significance. And I was told, okay, we don't really take action on variants of unknown significance. Just watch it, because if it changes from a variant of unknown significance to a regular mutation, then that might change things. Well, I just found out that the lab I went to considers it a VUS, that's what they call them, but the other major lab in America that does testing, and in Israel, the lab considers it an actual mutation and not just a variant. So what I would recommend to you is, at the very least, check in with a genetic counselor every few years and know what your VUS actually is, what the number and name of it is, and ask if it's still considered a VUS as opposed to a mutation. And every few years also ask, has the panel changed, and the screening panel changed enough that it's worth another test? And again, you could always call Sharsheret's genetic counselor and have a conversation with her about it. She's amazing.
Thank you.
Sure. Any other?
Hi, can I jump in real quick, Melissa?
Yeah, absolutely. Thank you for joining us.
It's so great to see everyone on here, and I'm such a big fan of Sharsheret's work and just your mission and how resourceful you are for anyone, especially for Jewish folk learning about their risk and how to navigate cancer. You're speaking about genetic panels and how they change. And I'm curious if you are aware of any new genetic testing that's coming down the pike. I know that the panel does update every few years, and that people are, you know, fastidiously working toward uncovering new genes, especially within the Ashkenazic Jewish line, that might lend itself toward more of a better understanding of why so many Ashkenazic Jews are coming up with positive breast cancer diagnoses. As well as if you might be able to speak at all toward the vaccine that I know is being worked on right now for breast, especially for BRCA.
Yeah. So we actually, before I even talk about the vaccine or updates in the panel testing, I will say that one of the reasons it's important to know your BRCA status, in addition to lowering your risk through surgery or catching it early through prevention, is that we know that at this point, and even when I was diagnosed 10 years ago, this wasn't true, but at this point, we have different medications that work better on BRCA-related cancers than cancers that just occur, for other reasons. So your treatment plan might be different if your cancer is fueled by a BRCA mutation. And that's really important to know. We have recently done a webinar in the last 6 months, and maybe in the last 3 months, and somebody asked the question you're asking about the vaccine. And what the doctor who was presenting said was, it's just not ready for prime time yet, but we continue to make advances, and they're very hopeful that within the decade, it might even be to people. So, I mean, that's not so helpful for many of us on the screen, but very hopeful for the next generation. And in terms of the genetic panel, I don't know that there have been, I don't know the answer to your question. And it would also depend on when your original testing was done. Like usually what our genetic counselor says is, certainly every 5 years you should be asking, has it changed enough to warrant retesting? But I don't know the exact mutations that it tests for at any given time. What I can tell you is, even 5 years ago, people were testing for BRCA mutations and that's it. And now it's the same cost to test for BRCA mutations versus a panel of over 100. The major medical grade screenings, depending on the company, range from over 80 to well over 100 different mutations. Which brings up another point, which is, when you want screening, what you want is medical grade screening. And there are a lot of ways to get that, right? Your local doctor can prescribe it. You can go through J-Screen. People of my generation and older just think of J-Screen as the testing you get before you get married. And that's not true anymore. Over the last few years, they have also initiated a medical grade cancer genetics screening. And it's a very reasonably priced screening, and their doctor writes the prescription and things like that. So that's an option as well. Anybody else?
J-Screen makes for a beautiful wedding present, just to let everyone know.
Yeah, absolutely. Or maybe even an engagement gift, so somebody knows before. But yes, yeah. Okay, so let me listen. I could talk about this forever. I want to end by talking to you for just a moment or two about your Sharsheret story. Again, someone doesn't have to be diagnosed to have a Sharsheret story. I encourage you to continue to attend educational awareness programs. We do 3 to 4 webinars a month on a variety of topics. Several of them each year are about genetics specifically, but they're also about developing a great relationship with your healthcare team. We're planning some now on breast cancer, breast reconstruction options. We're planning a series of 2 or 3 that should happen before the end of June on the impact of a cancer diagnosis on younger women, things like that. So there's always something good. And if you miss one of our webinars, like it occurs to me, one of our last 2 genetics webinars, our most recent one was about talking to your children about it, adult children. And the one before that was about variants of unknown significance. They're both on our website. We have transcripts and recordings on both of them. And I can actually send you links. Stephanie, I'm making notes here. Stephanie, you want the VUS webinar? And Cheryl, I can send you the talking to your children. I can send you the links, and you can either print out the transcript or watch the video. So definitely keep yourself educated. You know, you can help plan a program of your own, whether it's a parlor meeting in your home, a pink challah bake at the temple next year, something at your workplace. We actually do workplace programs for like lunch and learns. You can, like I mentioned at the beginning, race with Team Sharsheret if that's something you're interested in. You should all go to our website and check it out. Like us on Facebook, follow us on Instagram. And maybe most importantly, remember that we can help and share that with somebody who could benefit from our support. Most of the people that connect with Sharsheret actually do it through a friend or family member. First, because they're often overwhelmed themselves. So somebody will call and say, how can I help my friend get through this diagnostic period? And then once things calm down, they'll call us themselves. So knowing that you can make that suggestion yourself is an important one. For those who had some interest in either the brochures or the webinar things, if you want to leave me, either give Susan, if she knows them, permission to share your email or put them in the chat box right now. But I'm actually going to put my email in the chat box. It's easy. It's just mrosen@sharsheret.org. The hardest part about it is spelling Sharsheret. Okay.
Can I just say thank you again to both to Susan for orchestrating this and Melissa, to you for being present. I've lost my screen.
We can still see you.
You can still see me. Thank you. But I did want to say that Sharsheret was truly instrumental on my own journey. And in addition to all of the amazing women on this call, or people I can't see who's behind the 617 numbers, who checked in on a regular basis, Sharsheret actually did give me like a kind of a buddy there who checked in during multiple appointments and just knew the right questions to ask. And so if you do know anyone who is currently navigating, or if you yourself are navigating a cancer diagnosis and you want someone outside of the TBE clergy or pastoral team to check up on you, Sharsheret is another amazing resource, very warm and just caring along the way. So I want to say thank you.
Grateful we were able to offer you some support. Yeah. Okay. You have my email address, and of course, Susan has it. If you don't think to copy it down now, you can reach out about anything.
Alyssa, thank you so much.
My pleasure.
If you guys have any questions, need any follow-up, you certainly know that you have Melissa's email. I have the recording for any of your friends. I will make sure to send it out. Sandy, I hope you heard the Lunch and Learn chat from Melissa. You certainly should book her for that. Thank you all so much for coming. And
Thank you.
Thank you.
Thank you, Susan and Melissa, for planning this.
And Melissa.
My pleasure being here. And hopefully we'll connect soon about more great initiatives.
I look forward to it.
All right. Bye-bye.
Bye-bye.
Bye.